Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a condition called gout. So gout is really a complex, common problem, type of arthritis, really type problem, where you get a red, swollen, painful, inflamed joint, and it's quite common in the foot and ankle. In fact, the big toe is commonly one of the places that will present, or the ankle, though you can get it in any of the big joints. And really, to give you a little bit of background, gout is depositing of uric acid crystals into a joint that causes it to get inflamed, painful, and tender. Can make it very, very stiff, can make it very, very hot, and can be pretty problematic and pretty limiting in the way that it functions and what it does. So that is usually what people present, and they're having severe, severe pain. When would you go to the doctor? Well, when you've got such high amount of pain that you can't control it, you can't get control of it, so you end up going to the doctor. So first off, let's start on talking about what the causes of gout are. Gout is either an overproduction or an incomplete removal of urate or uric acid from the body. Uric acid is a common component or common side effect of the breakdown of purines. Purines are substances that are commonly found in the body, but are also found in certain types of foods like red meats, steak, organ meats, seafood. They could be found in cheeses and in wines. It used to be called the rich man's disease because these were the foods that they would eat, and they would get a red hot swollen foot or red hot swollen big toe because of the way they were eating. And this was gout, or podagra as they used to call it, and it's a presentation in those joints that could be really, really quite painful. Now, there are risk factors. There are reasons why this may happen. There are certain types of diets, like we talked about, rich in meats and seafood and drinks, whether it's alcoholic drinks or really sweetened fruit, sugar beverages like fructose type beverages. Obesity, medical conditions that could include such things as high blood pressure or diabetes, metabolic syndrome, heart or kidney disease. If you're having a hard time with your kidneys removing uric acid from the body, you can get a gout as well. Certain medications can cause it, the most common being the certain types of diuretics. Family history. If you have a high family history of gout, there's a possibility you could have it as well. Age, usually it's going to be the age between 30 and 50, and it's usually going to be male more than female. There seems to be a lot higher uric acid levels in men as opposed to women. And you can also have a recent surgery or trauma. If you have a tendency to get deposition of uric acid crystals in an area, if you damage that area, it's more likely as the blood increases to that area that you get crystal formation or crystal deposition in that area. And really, there are things that you should be doing. So if you have a tendency to get your gout, there are things that you can do to minimize it. One is drinking plenty of fluids, especially water. The more water you drink, the higher possibility you have of washing out the urate or the uric acid and keeping it from depositing in the joints that are furthest away from the heart, the colder areas. Limiting or avoiding alcohol, controlling the protein intake from red meats, seafood, those kind of things. And obesity, of course, is a risk factor. So if you can control the obesity, so you can get your body weight under control, there's a higher chance that you won't get the presentation of gout in your body. So how is it diagnosed? How do you know if you have gout? The first is presentation. Red, hot, swollen, painful joint leans towards the possibility that it being gout. The next step is usually doing an x-ray or ultrasound where they actually examine that joint. One, x-ray looking for any other reasons that you could be having that. Sometimes you can even get little cystic changes to the bone that they call rat bite signs on the x-ray where it's like they're taking a little piece of that bone out that can indicate chronic gout in that area. Ultrasound can show the crystals as the sound waves vibrate and cause it to be seen there. You can do CT as well, possibly for this. Typically, I would not do that. So how can it be treated? There are both medical treatments and there are at-home treatments that have been shown to work. The most common medical treatments would be certain types of non-steroidal anti-inflammatories, colchicine, and corticosteroids, although there are some newer medications, including some IV medications that work really well at removing all the urate, all the uric acid crystallization from your body. The idea of all the medical treatments is, one, you want to either block the uric acid production or you want to improve uric acid removal for long-term type treatments. So acute treatments, corticosteroids, non-steroidal anti-inflammatories, and even the colchicine. Long-term treatments, you're looking at medications that will block production or increase removal. There are some home remedies that have been found to work, of course. The most common is vitamin C. Although there are not real good studies that show that it works, it has been shown to reduce this. That's why a lot of times when they say, okay, you have a tendency for gout in your family, or you have had gout attacks in the past, if you increase your vegetables and fruit, especially oranges, you will have an improvement of the amount of attacks and the severity of the attacks. Cherries seem to be very good, especially tart cherry juice is what a lot of people will talk about both alleviating the symptoms as well as preventing it from coming back. So gout, it is a common problem. There is a similar problem that's not caused by uric acid, which we will talk about tomorrow, called pseudogout. But if you have a red hot swollen foot or red hot swollen joint, the most common thing that it could be would be gout, and it should be examined. You can actually even sometimes take blood tests to see if you have a high uric acid levels, but usually this is only going to be the case, the high uric acid levels, if you don't currently have an attack going on, because once they deposit in the joint, they're not in the blood. Or you could actually do an aspiration where you stick a needle in and pull the fluid out and have it looked at for the uric acid crystals. Really, the treatments don't change if you have uric acid crystals in the joint. Usually treat it the same way, so sometimes we avoid the trauma that comes with sticking a needle in and drawing the fluid out. This is Dr. Brandt Gibson, and this is your podiatry tip.